Hello, it's Dr. Rhonda Johnson. Today is Sunday, December 10th, 2023, and today I'm talking about dengue. Why am I talking about dengue and what is it? Well, stay tuned and you'll find out. Well, first of all, more dengue fever cases have been recorded so far in 2023 than in the last 5 years, and this has to do with increasingly extreme weather events with warmer weather, longer rainy seasons in some tropical and some subtropical areas, which is leading to great growth conditions for mosquitoes. So what is dengue? Dengue is a potentially fatal acute febrile illness caused by infection with any one of 4 dengue viruses, dengue 1, 2, 3, or 4. Now, dengue viruses are transmitted primarily through the bite of 2 types of mosquitoes, Aedes aegypti and Aedes albopictus. Those are the mosquito names, and I apologize if I mispronounce them. But moving on, once bitten by one of these female infected mosquitoes, 3 out of 4 people who are infected with the dengue virus will be asymptomatic. 1 in 4 people infected with dengue will get sick. Now, once bitten, as I said, 1 in 4 get sick once bitten. And people who get sick can have either mild or severe symptoms. Now, the most common symptom of dengue is fever. And the fever can be accompanied by severe headache, muscle and joint pain, nausea, vomiting, and a rash. And then there's a severe dengue, which can in fact affect 1 out of 20 people. And that can be a life-threatening illness within a few hours and often requires care at a hospital because severe dengue can result in shock, internal bleeding, and even death. It is considered a medical emergency. Now, children are particularly vulnerable to this virus because they tend to play outside where there's less protection against these mosquitoes. And children under 5 are at a particular risk of developing dehydration and shock if they get sick. And of course, children are impacted if dengue incapacitates or kills their parents or other caregivers. Now, there is no treatment for dengue itself. There's no vaccine yet, and the treatment consists of supportive care, taking care of the symptoms, such as volume loss or internal bleeding. So the countries who have had the most cases of dengue fever this year are Brazil, Paraguay, Argentina, and Bolivia, all in South America. But Bangladesh had the highest death toll, primarily because the lack of access to medical care prevented the support for people with severe dengue disease. Other nations that have had a high death toll were Brazil, Peru, and Burkina Faso. Now, Haiti has been reporting elevated dengue fever activity. So what about the United States? Dengue is common in the U.S. territories of American Samoa, Puerto Rico, and the U.S. Virgin Islands. Now, in the 49 continental states, most cases occur in travelers who were infected elsewhere. Prevention is all about mosquito control, trying to avoid breeding of mosquitoes and laying their eggs in standing water containers that can be around the house, like buckets, bowls, animal dishes, flower pots. These mosquitoes bite indoors and outdoors, day and night, the ones that transmit the dengue. So the best way to prevent dengue is to protect yourself from mosquito bites. Now, this may be a disease you never heard of before, but you're likely to hear more about it in the coming years due to climate change. That's my message. Take care, folks. Be safe and be well.